The Community Health Learning Program, started by Sochara in 2002, is a new space for learning, a new process of exploration, a new pedagogy of experience, building a new perspective in community health action. We explore and explain this new space of learning in this film and how Sochara evolved it as Campus Without Walls. What is community health? A movement of health innovation and innovators since the late 1960s in the country has been deeply studied by CHC, Sochara, ever since its inception in 1984 through active participation and engagement. In this process, Sochara identified and recognized many key axioms that symbolize community health, which is a process of enabling people to exercise collective responsibility to their health, demand health as rights, increase autonomy over health, integrate health and development activities, build decentralized democracy, build equity, build community beyond caste, class and gender, make accountable medical infrastructure, build countervailing power from below, be part of a larger social movement. All these aspects form the spokes of the wheel of community health. We can see this wheel running in many of the organizations like Accord in Gudalur, which are part of the community health movement.
Yeah, my name is Subramanian. I'm the Secretary of Adivasi Munnet Sangam. We started an organization called Accord and after that AMS Adivasi Munnet Sangam. Mainly we started the work with the tribal people to get their rights because Adivasis for centuries, generation by generation, mainly the tribal people, Paniya people are in bondage. No? We are just released from the bondage. Our main focus is to get back their rights and their land also. So from the beginning we started a land rights campaign and empower the people to start cultivating and getting back their land. All that work we started. So gradually, depend upon the people's needs, our work is changed. So their health education work also we involved. So we have to give the education. So started the school program and Vidyodaya school and GTR school and enrolled the tribal people in the school, children's in the school. All that work we started. Then mainly Accord started for economical development and community organization work. So that work also among the people, and we divided in Gudalur Taluk we divided 8 area. In 8 area we worked, 8 area we set up a area center and like a decentralized project we set up here. Same time the health is very important for the people. So when we go into the village, we saw many people are ill and sleeping in the outside and very miserable situation in the villages. So we got involved some new people, doctors, and we started a mobile health program. And first we started giving the immunization program for all the tribal people, and before that no one is immunized. So that work we started. Then health work is very major program. Then this 8 area we worked as a health and education and economical project like that. So we set up a Adivasi hospital in Gudalur. So that on base of Adivasi hospital we worked in the 8 area. In 8 area we appoint health animators and some health workers and village level health coordinator. All that kind of work setup we started here. So economic development, health development and education, all 3 aspects we are worked.
In the year 2002, Sochara felt the need for a space where young community health professionals could see, observe, learn, engage and explore all of these axioms. Thus, the Community Health Learning Program, CHLP, evolved. Over the last 10 years, more than 300 young people have participated in this program with different disciplinary backgrounds from all parts of India, representing all social groups, eager to start a community health journey. Over 3 decades, Swachhara has celebrated such community health journeys, and the CHLP is one of the fruits of that celebration. The current community health learning program is for a year, divided into 7 phases. 1. Collective learning. 28 weeks of theme-based learning divided into 4 blocks at the center. 2. Field postings. 24 weeks of community-based learning in 3 block postings with field mentors. The learning at the center is built around a participatory and interactive pedagogy, where there is no teacher-student system but a learner and a learning facilitator learning together. The learning facilitator provides the space to question, to explore in depth, and to learn by doing. At the center, the fellows undergo interactive lecture sessions, group discussions, practical sessions, group exercises, and skill development. Field postings is a very crucial and core component of CHLP. Learning from the community by being in it is an integral part of the program. The fellows are allowed to choose from over 85 mentor organizations from all over the country, which in turn is part of the network built by Swachhara over the years. In these organizations, which are field mentors linked to the CHLP programs, fellows focus on a theme for each of the 3 postings. Let us now look at some of these field mentoring organizations. Action for Community Organization, Rehabilitation and Development, Accord Gudalur, began for human rights, health, education, housing, and culture focused on the Adivasi community. Their mission is to redesign the systems necessary to help the Adivasi community cope with the onslaught of modernity on their way of life and to prepare them to emerge from their forest retreats with their heads held high, proud of their culture and their people. Tribal Health Initiative, THI Sitilingi, works to improve the lives of the Adivasi communities living in the Sitilingi Valley and surrounding hills through a variety of programs in healthcare, community health, farming, alternative education, women's empowerment, and craft work. They view health as a state of mental, social, and economic well-being, and not the mere absence of disease. Their health interventions go beyond merely providing curative and preventive medical services to a more holistic view of health and development. Mysore Resettlement and Development Agency, Mairada, Gulbarga. Mairada is committed to building institutions of the poor and marginalized, which are appropriate to the resource to be managed and the objective to be sustained. It fosters a process of ongoing change in favor of the rural poor in a way in which this process can be sustained by them through building and managing appropriate and innovative local level institutions based on their rights and rooted in the values of justice, equity, and mutual support. In these organizations, which are field mentors linked to the CHLP programs, fellows focus on a theme for each of the 3 postings. Phase 1. Understanding Community Dynamics with a Checklist. Here is Jason, a current fellow understanding psychosocial challenges of young adults in Sitilingi as they experience the challenges and stresses of unemployment and migration, building and understanding through dialogue. Phase 2. Learning Community Health Action by Doing. Here, Asha and Fatima, also current fellows, are learning about community health action in Mairada program in Gulbarga by participating in action in the Anganwadi and the neighborhood as part of a child-oriented community health program. Phase 3. Field Enquiry by undertaking a field study. Here, Rajiv, a dentist and current fellow, is exploring the ethnography of oral health through dialogue and discussions with Adivasi folk healers in the communities covered by Accord Gudalore. Field mentors. An important component of the field posting is the presence of a field mentor in each organization who is also a learning facilitator and a friend who accompanies the fellows through learning and discussion, asking questions and exploring the situation together. This is what the field mentors themselves had to say.
Mentor should be a person who's balanced, who's mature, and who's capable of taking the responsibility of nurturing a youngster who's willing to listen to you. So it's a huge role.
I don't think I'm mentoring people here, but it's kind of, I would mention, I would call it co-learning. Like, we learn together.
I've always felt it's a huge responsibility. One is because the fellows are like people who are genuinely interested in community health, to explore community health, and now being a mentor is like, my role is to give them what they are coming for, at least what they are looking for, in terms of letting them explore the community health and stuff.
Yeah, I wouldn't call myself a mentor, but if I'm supposed to call myself a mentor and mentee, the kind of relationship between these two people is very, very important. We believe that the relationship between two people is more important than the work that you do. So for me, it's been like we are just colleagues. We are working on one thing. We are more of friends, and we are kind of trying to do one particular thing together. And it's a very nice environment to work in.
Mentoring is for people who actually are confused, you can say, in a way. I mean, people who are just not decided what to do, and you can mold them, you can guide them, give them new ideas.
This kind of provides a lot of time for the person to understand, and I feel this model is like really good.
The role of mentor, I would say, is to make the mentees or the people to think. You give them the stuff and question them, let them think on their own. They'll find their own answers. It might not match with your answer, but they'll always find a way, find an answer.
Governance. Towards strengthening academic and scientific aspects of CHLP, Sochara has evolved two governance mechanisms. The first, Academic Research Council, ARC, and the second, a Sochara Institutional Scientific and Ethics Committee, SciSec. ARC was formed to strengthen governance, and SciSec to look into the scientific rigor and ethical issues related to research initiatives of fellows, staff, and associates of Sochara. Also at the heart of the program is the Community Health Library and Information Center, or the CLIC, a resource center in the area of community health, public health, health policy and development, which has a rich collection of the diversity and wealth of community health learning resources in the country, particularly the civil society sector in India. Many have experienced this unique program and are now making an exceptional change in society. Let us now listen to what they have to say.
The one thing that I really appreciated about CHLP was the diversity of students. So within my batch, we had this entire range. We had people who literally came out of the field. We had people with a lot of experience, very highly educated and qualified. We had a 50-year-old nun. So what I really liked was the diversity of students.
The immersive nature of the program, where you just don't learn theory and then there's a separate practicals. It's all very integrated.
CHLP learning was like both field work as well as classroom studies were dealt with, as well as there was the opportunity to learn myself, what I am and how I can go about.
The experiential nature of the course was one of the aspects which really stood out for me. Meeting people from so many different backgrounds, studying together, reflecting together, going and doing work together.
There was also a good diversity of instructors. I mean, some were mainstream practitioners, some were actually activists, So all of it, I would think, as a whole, it gave us a very good exposure.
CHLP learning was like helped me to inculcate in me the passion for the work that I'm doing and to have a commitment in the work that I'm doing.
The link between the macro issues and micro issues, and how, you know, they're not different or separate issues. I think that was a key learning for me.
I think it's this exposure. I mean, most people don't really understand the issues that we have grappled with in healthcare, and for me it was a very good exposure.
I had mentor who can guide me every now and then. For anything that I had, any questions, I can go to him or go to her and clarify my doubts.
The experience at CHLP trains one to think in a particular way, which is looking at issues from different perspectives, and so it gave me that sort of skills to do that. And secondly, also meeting a lot of like-minded people, it strengthened this whole belief that change is possible, and that there are a lot of people who desire for a change in the existing social system and way things are done.
I was more interested working towards the children, issues of children. So though it was not exactly can be considered as community health, yet I could relate that to the community health. So that was my, direction that was given to me. That was like really helpful for me. That was, I can say that was a key learning for me, and relate my work to the learning from here.
Currently, I work mainly on 3 different groups. One is Jan Swasthya Abhiyan, the People's Health Movement. We are organizing a series of public hearings on the right to health across India, and it's perhaps an ambitious endeavor. We are trying to highlight the denials of healthcare both in the public and private sector.
I'm part of a group which founded an organization called Headstreams, where we work on bringing change through play, through play, creative solutions, using art, using music and dance, using stories in different settings, in formative settings, in transformative settings, in reformative settings. So this is what I do currently.
And the nice thing about this work has been that we very quickly realized that healthcare is not just about health services, but also about the social determinants of health. So what I see is, what many people have discussed in academia, have discussed in international treaties, playing out in the field.
Right now I'm working for an anti-human trafficking organization in Bangalore, and the learning has helped me in while I'm working here to network with other organizations, as well as after the rescue of the children or whomever we rescue, we reintegrate them to the families. So rebuilding the family, that was also I'm practicing it.
The contacts that formed in CHLP have led to my work at Jan Swasthya Abhiyan today, and it's given me some useful perspectives and exposed me to certain knowledge sources which would have taken more time otherwise to find.
Even after leaving from here, I found it like people are interested in me, and they were asking me how am I doing in my work, what is that I'm learning, or how am I growing. That was like really helped me. No one, even I did many other, I went to other colleges, but they were not much interested in that level.
What is it that one expects after CHLP, right? What is it, if one thinks of it as one step in a career path, then people can find more lucrative educational opportunities. CHLP is not that. CHLP is a place to broaden your mind. That really, I think, broaden your mind and your heart. Somewhere where you realize that there is more to mainstream commentary, right? Where you learn to actually analyze the mainstream commentary. Now that may not necessarily get you a good job, right? But then I think that's very useful life skills.
If you wish to be part of the Health for All movement and initiate your community health journey, please visit our website www.sochara.org and www.communityhealth.in. Or you could connect with us by visiting us at our center in Kormangala, Bangalore, or our centers in Chennai and Bhopal.